Okay, and we are live. Good morning, good afternoon, good evening. Wherever it is you are joining us from, thank you so much for taking time out of your busy schedule, out of your busy day to join us today. This is Living LTV with live with me, Dr. Gbenga. And today we're taking a look at something very, 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 very important. We're taking a look at infertility. Infertility, yes. Infertility. We started last week. We had a few um, technical issues with our internet connection, but we are here today. And I believe we tried to make our connection better. And I believe that we'll make good speed. Thank you, Michael. Good afternoon. Welcome, welcome. So, as we do, if this is your very first time of joining us, I'd like you to please do me a favor. I'd like you to please introduce yourself in the chat box. Let's get to meet you. Let's know where you are joining us from. I know some people are joining from Abuja, some people are joining from Lagos. Are you joining from outside the country? Please, let's meet you. Let's know where you're joining us from. Get on the way. One more thing you're going to do for me, you will please share this link somewhere in a group that you belong to, on your WhatsApp status, on Facebook, on wherever you think you can share it, and let people know that we are live. We are live. So please go right ahead and do those three favors for me. And of course, not forgetting the fact that if you are here to subscribe to Living LTV, please go right ahead and subscribe right now. Yes, hit the subscribe button. Let's get you be the first to know every time we put out a new content. Yes, thank you so much. So we're taking a look at infertility. Infertility. We are discussing what it is, what it is not. Last week, you can go and watch last week's video. We did a little bit of um, can we say, wetting the ground last week. Did a little bit of a discussion, but for the sake of those that didn't join and have not been able to watch, I will just do a brief roundup of all the things that we said last week. We said infertility is when a couple who have been married for not married because of course nowadays some people are not legally they're not married but they want to have children. So it's a couple that a male and female that have been trying to have children with regular sexual exposure for 1 year, one calendar year, and have been unable to do so. Now, there are key things in that definition. Number one, of course, is regular sexual exposure. So, it's a couple have been meeting regularly. And what does regular mean? For some people, I remember a joke my professor told me many years ago that one man was teaching, was in a class, and then suddenly he just started saying yes. And he said, "What's happening today?" The guy said, uh, I have sex with my partner just once a year. And he was very happy about it. And said, so why are you so happy if you meet with your partner just once a year? The guy said, and the day is today. So for him, his routine is once a year. Okay, once a year. So regular sexual exposure may mean different things to different people because when we use such words, some people regular for them maybe once a week. Some people regular for them maybe twice a week. Some people regular for them may even be once a month. Based on their own mindset of what regular means. But for us, for the purpose of fertility treatment and this discussion, regular is at least every other day, right? At least every other day. That's like 4 times a week. Not 4 times in one day, right? 4 times spaced out over a week. And that's based on the understanding of how the sperm cells and the eggs, how their life cycle. An ovum, right? A female egg, we survive for about 24 hours, give or take, about 24 hours. While a sperm cell, we survive in the female genital tract for about 72 hours. So if you meet every other day, you give a high chance to at least there being sperm cells in the female genital tract for whenever an ovum is released, right? So very important because we see people that the challenge of their fertility is that they are not meeting regularly, right? They don't meet regularly. They just meet they are fighting when the woman is ovulating, and they are just not on talking terms. That's the devil. Somebody said that's the devil. Okay, maybe that is the devil. So regular sexual intercourse for at least 1 year, right? 1 year, and then we now start to say there is a fertility problem. Of course, like you said last week, if somebody is 40 years old, right? If a lady is 40 years old and just got married, just wants to start to try to have a baby, just we won't wait for 1 year in that instance, right? So if after 3 months, even ab initio, we'll try to take proactive steps to make sure, because menopause is just knocking around. So we've seen people that achieved menopause at 40, right? They became menopausal at 40. So, but the underlying fact is that regular sexual exposure is important, and then the time frame that we are looking at. So, if you know enough people, you will know people that are looking for children, right? Um, Globally, the incidence of infertility is about 5 to 8%. But in our environment, in Nigeria and around us, it's at high as 10 to 30%, right? That's 1 in 3, almost 1 in 3. 1 in 3 couples may be looking for kids. That is, since we did that show last week, I do a number of people have come to say this. Oh, we need this. No, so there are issues. People are grappling with fertility issues. But the good news is that no matter what is the cause of your fertility issue, there is treatment. And treatment in our environment. So when I say an environment, I mean in Nigeria, right? Treatment round about us here. Like I was saying to people last week, and I've said to some people as we discussed over the phone, there are people that travel from outside Nigeria to come into Nigeria so that they may enjoy the fertility treatment options that are available here. Because number one, we tend to get good results here. Some people are the specialists here. Some of them are really getting great results, and the cost is not so astronomical. So people, if you speak out, get the right help, your chances is from the whole extreme, from whatever it is that needs to be done. Either it's just ovulation induction, whether it's just it's IVF, surrogate parents, sperm donation, egg donation. The whole gamut of possibilities are available right here in our environment. So please don't keep quiet. So what are the causes of infertility? Because in our environment, somebody was speaking to me some time ago, and she was really bitter and angry about it. And I said, "Well, what's up?" She said, "Why do they call it fruit of the womb?" So that, but even by the way we tag pregnancies, we ab initio make it that it's the woman that is at fault if there are fertility issues, and that's the underlying assumption that every time a couple are unable to conceive, it just means that something is wrong with the woman. That's not necessarily the case. Not necessarily the case. So we know that for up to 30%, in some instances, maybe a little higher, of people that have issues, couples that have problems with fertility, it may be a female factor. When we say female factor, that means yes, something is wrong with the woman's reproductive capabilities. So it could be an hormonal issue. It could be something that has to do with the eggs, the ovaries, or the tubes, the fallopian tubes, or the womb itself. So all those issues are there, right? But we know that the most common cause in our environment is PCOS, polycystic ovarian disease. But all these things are amenable to treatment. It could even be something as simple as producing the production of the hormone that makes a woman to express breast milk, and of course, if you are expressing breast milk, breast milk production precludes in most instances the ability to get pregnant, right? So those factors are there, but all those factors are amenable to treatment. Diabetes, endocrine issues, or other issues with your hormonal system. I don't like to use those big terms while we are living LTV live or we are an area doctor, as we discussed them for area now. We like to break them down, make everybody understand. So, female issues. But up to 30% of times too, it's not just women that have issues. We have male factors in fertility issues, male factors. So something may be wrong with the man. It may be wrong with his sperm generation. It could be diabetes. It could be an endocrine issue. It could be untreated infections. Some people, while they were younger, or even they feel it's their exploit to just sleep up and down, and they picked up infections that have damaged their testes and their sperm production capabilities. So it is important. Male issues, male factors. I remember, like I shared last week, when I met school, there was a guy. We have different types of problems with sperm production. You could have reduction in your sperm count. Right? There's a certain level, there's a certain number. If you are getting less than 1 million, 2 million, you start to think that something is wrong. At one time, it used to be as high as 200 million sperm cells. Used to be, but for many reasons, some people say it's because of what we eat, pesticides in our food, the way things are in our environment, and lifestyle factors that is making sperm count. So people now have 30 million, 50 million, 20 million, right? That's reduction. That's a marked reduction from what we used to be the average decades, just a few years, not so many years, maybe some decades ago. So we have oligo. So you have reduction, 1 million, 500,000. That's really, and then you now have problems with the way the sperm cells are. It could be with their shape. They may not be moving well. Rather than moving up, they can move here and move just right. So in motility and shape. So you have oligospermia. So you have reduction. And then we have some people that they produce their seminal fluid, and there is no sperm cells there at all. None. Azoospermia. No, not one single. That's what this guy had. It was not producing sperm cells at all. And so they counseled him, told him this was what was wrong with him. His wife was perfectly okay. There was nothing wrong with her. She could get pregnant if that man could just supply enough sperm cells to fertilize the eggs she was producing. But the man, for his ego, will not hear that. He doesn't know. There's nothing wrong with me. I'm perfectly all right. Fine young man like me. Action man like me. So without much ado, the man divorced, took away his wife, and started dating somebody else. Guess what happened? The new lady he picked up, of course, got pregnant and carried a baby. But to us that knew his condition, we knew that baby, for all intents and purposes, was not his, because the man was not producing any sperm cell. No, was producing nada. So when people got to know that what this man wants is just a baby, he doesn't really care how he gets that baby. So somebody manufactured a baby for him, right? So male factors are important and then of course we could have combined factors, right? So it's neither just the man that has an issue, neither just the woman that, so something is a little wrong here, something is a little wrong there. Putting that together, then we have infertility. And infertility can be a problem that gives a lot of stigma, right? When people see you, so when is the baby coming out? When is the baby? There was a time one of my friends, like my senior friend, she just came to me and said, "Gbenga, give me a baby." So I want to have a baby. I want to, because people keep asking him, "Where's the baby? Where's the baby? Where's your baby? You've been married 10 years. You've been married 15 years. Where's your baby? Where's your baby? Where's your baby?" It can get to a head. But the good thing, like we are saying in the program today, is you can get your baby. Infertility can be treated. Fertility treatment is part and parcel of family planning. Family planning is not just for people that don't want kids, right? So people that also want kids should have access to the treatments that they need, the help that they need to conceive and have their kids when they want them. So there are many management options. So many. Right. So thank you to everyone that is live and following us. Please go right. If don't wait to the end. You can start to drop your questions as much as possible. This is an interactive show. We like to try to get your feedback, try to know what you need, what you are thinking, if you're following, if I'm saying something that doesn't make sense. Please go right ahead and ask. I'll be happy to answer and get your feedback as we discuss along the show. So, so what do you do? What can you do if you, a friend, somebody close to you is having problems with fertility? The first point of call is counseling, right? Counseling to know, to understand that this problem, this issue is something that must be approached and handled as a couple with patience, right? With patience. Because do you know what? I said that there are male factors, there are female factors, there are combined factors, but also for a number of couples, they don't know what's wrong. And sometimes for those couples that there's really nothing wrong, you can just see that in the middle of a fertility treatment, while the doctor has just started doing something, talking, running tests, they just get pregnant. And it may look like, oh, it's the doctor that did it, but in the true scheme of things, that physician will just say, I don't even know what, I didn't really do anything. Because for many people, there may not be anything organically wrong. It may not be time, chance, lack of things that, and then we don't know what's wrong. We really can't say this is what is wrong, right? So counseling is important to set expectations, because even with fertility treatment, there are failures. It's not everybody that at the same time that commence treatment, at the same time we all get pregnant. There are times for people who do they will do fertility treatment, if it's IVF, assisted reproductive techniques and all that. They will do it first time, they do it second time. I know someone that for many she had tried, it didn't work. So a new friend just went to say, okay, let me just try. Final time, try. And then at over 50, she got pregnant, right? She got pregnant. I look forward to hearing the good news soon that she has had a baby. So it's counseling, it's very important for expectation setting. Counseling for you to, if it's the man, because of men, like I said, they just nothing is wrong with me. I'm perfectly fine, and they don't want to come. They don't want to go and see the doctor. No, it's not just the fruit of the womb. Yes, unfortunately, that is almost fixed in our lexicon. We call it the fruit of the womb, the fruit of the womb. And that presupposes that it's the person that carries the womb, that's the woman, that something is wrong with her, that something is the matter with her, not necessarily. So it's a couple's thing. The husband, the wife must see this, that they are in this for the long term, that we want to solve this, and we will patiently go about solving it. So it's not that you do 1 month with this doctor and then you hear, oh, Oh, there's one odd doctor somewhere. There's one odd fertility treatment somewhere. You try that one for another 2 months. You move from there, pay again and do another place. You move from there and you are jumping up and down from pillar to post. That actually may be counterproductive. So, of course, there's always the place for a second opinion. If you are not happy with the level of service or or help you are getting from a particular care provider, you can discuss it with that provider and go for a second opinion. The point I'm trying to make is that it's not something, fertility treatment is not something that happens this month, then then the next month, So it doesn't happen in 1 month, 2 months, okay, I'm going somewhere else. So first ascertain the competence and the costs of the person that you are working with, that is treating you. Get comfortable with that person. If you are not comfortable with that person, as quickly as possible, look for somebody that you are comfortable with and follow the counsel and the advice of that person. Don't jump from A to B, from pillar to post. It is often counterproductive. So counseling, very, very important. And then, of course, the things that follow is investigations, right? The physician is going to try to figure out what's wrong. And these investigations, they can be pricey. They can be expensive. So that's no reason why you can't be jumping up and down. Don't just say, nothing is wrong with me. Nothing is wrong with me. If you have been trying to have a kid for 1 year and you've been meeting regularly with your partner and you are not having a kid, please go for medical help. Going for medical help for people that are of faith does not mean you don't trust God, right? Just like using seatbelt. We don't say because we don't trust God, we don't use seatbelt, or we don't get the help that we need, right? You don't go to work because you trust God to provide for your needs. After all, He sent birds to feed Elisha, so He can also feed. Yeah, He can if He chooses to do so. But however, God has placed people around us that can help us. So go for help. Go for help. And that help may just be counseling, may just be advice, may just be to find out what is wrong. Let's see, something wrong. Are you menstruating regularly? Is your period okay? Let's check the man. Is the seminal free? Is the semen? Does he have enough sperm? Is he producing adequate amount of sperm? Just start it. Go for help. Please go for help. And then, of course, like I said, investigations. You've investigated. You try to find out what is happening. And some of those investigations may be painful, HSG, that's hysterosalpingography. So when we take a picture, we try to take a picture of the womb and the fallopian tube to be sure that the tubes are open. Because for so many people, infections may make the tubes blocked. Even for people that are, if you had a very, very tough pregnancy, so you got pregnant and then I'm not talking about you just had an infection after your pregnancy. Such infections may block your tube. So that's why you have some people that have had children and then they can't have kids anymore. We call that secondary infertility, right? So you've been pregnant before, you have one child, and then that's the only one. You've been trying, but you have two, and you are trying for the third. I hope after three, you're not fighting for a fourth, but it's okay. But for secondary infertility, so someone that has been able to have a child before, be able to get pregnant before, and then the person is now unable to get pregnant. So we now know that, okay, that person has, for instance, is producing egg, has a womb, the tubes were patent. So that informs another line of treatment. So you go for investigations, right? And then after investigations, then the different management options available, depending on your age, depending on your circumstances, depending on what was found out when you were investigated, then your doctor will give you a treatment regime. So if the man is producing enough sperm and it just looks like the woman is having problems ovulating and producing enough eggs, okay, so the doctor may try to give you something that will help you produce more eggs, give you some medicines to help stimulate that, and then tell you, okay, you're taking charge of your cycle, you are going to, and then uh, you get pregnant. So some of those people, the beautiful thing about fertility treatment often is that after one of the things that happen with pregnancy, so we have multiple pregnancies. So someone that's been trying to have kids for some years, suddenly with medical assistance, gets pregnant, twins, triplets, quadruplets, right? 4 babies at once, and the person can just close shop if you have. So, but those are some of the things that happens with the fertility treatment that we do. IVF, in vitro fertilization. So that means they take the sperm, take the egg, combine it together, let them reach a certain age, and then put it back into the mother to gestate. That's an option. And if a woman is not producing eggs anymore, there are people that donate eggs. Right? Just the same way any organ is donated, there are people that donate sperm cells. Just the same way any sperm cell, any other organ is donated, you carry it, put it in the mother's womb, and the baby is carried to term. Okay, the mother doesn't have a womb, but something is wrong with her womb, or for a medical reason, she cannot carry a baby. Okay, there are people that give surrogate motherhood. So they donate their womb to help carry your baby, right? And then your baby is carried to term. DNA test is done to confirm that it's your baby, and you have your child. So no matter what it is that you are facing, no matter what is the reason that you are finding it difficult to have a baby, hope is available. And if everything else fails, you can always adopt a child, right? Because I think that parenting is a responsibility, and that responsibility can be extended to any child that is given to you to raise, right? Any child that is given to you to raise, you can be a parent if you have been the one that was responsible for that child's feeding, upbringing, education, shaping. That person is your child, right? It's your child. And there are so many kids out there that are looking for a good home, people that have been abandoned, right? Abandoned in dumpsters, abandoned on the road, in orphanages. Their key parents died and there's nobody else to take care of them. You can be a parent to one of those kids and give them the luck, the fortune of a beautiful, peaceful home, you raising them up. So that is a lowdown in 30 minutes of infertility and the things that are possible. So if you have questions now, I'll be happy to answer those questions. And if not, we can call it a day until we come again next week, Friday, by the grace of God, with another interesting, lovely topic. So, do we have questions? Do we have questions? I've not seen our regular members online today, right? Timitope and the gang. Right, Michael, thank you so much for joining us. Thank you. Appreciate your coming online. All right. Do we have any question? Any question, issue that we've raised today, or even if it's not something we've raised today, but something that is burning on your mind that you like to talk about on Living LTV Live today, right? Any other question? Okay, so in the absence of any question, I say big thank you to everyone that has joined us today. Please go right ahead after we are through. Share this with friends, with loved ones. Oh, Julian, thank you. I was wondering that I've not seen my regular viewers today. Thank you, Julian, for joining us again. Thank you, thank you, thank you. All right. If there's no other question, God bless everyone. Have a fantastic weekend ahead. I wish you a restful weekend full of profit. God bless you. Oh, thank you, Madam Odope. Thank you for joining us. Thank you. Thank you. I don't know if you have a question. I'll be happy to answer your question. I'll stay online, they are just questions. Questions. Thank you. Thank you. Okay. Okay. So you have a friend abroad who's abroad but denied. Okay. I guess you are still typing, so I'll wait for you to finish typing. Oh, Temitope, you're online. I was wondering, where's Temitope now? Temitope is always online. Thank you so much. Was denied treatment of IVF because of our BMI. Okay. What can be done? So there are very, like I said, there are so many treatment options. So I don't know what so if the doctor weighed the chances, look at our general, not terms of your BMI, look at our total health and well-being, and say, okay, the chances of this person carrying a baby to term may be limited, or it may adversely affect our own health. It may be that because of our BMI, she may also be diabetic, along with obesity, she may be hypertensive. You don't want to, force such a person to carry a pregnancy because the chances of that pregnancy failing may be high. So we have other things that you may not be aware of. But if she's producing eggs and her husband has sperm, so the issue now is that they just need somewhere now for that baby to grow. So a surrogate mother may be an option for them. So I don't know what country that they are in. Different countries, fertility treatment is May, good to see you too. Fertility treatment and options are regulated in various communities with various laws. There are some countries that don't permit surrogate motherhood because of their experience. They may say that, or if there's a surrogate, because some people just come, dump, carry babies, they make it like a baby farm. But there are other climes that permit surrogate mothers. There are some that permit surrogate mothers, but the person must not be paid, right? The surrogate mother must not be paid. There are other places that permit payment and agreement. Because in some places a surrogate motherhood, a parent may lead to legal complications. If the mother says, okay, I'm not giving you the baby anymore, I carry that in my womb. But surrogate motherhood can be an option for this your friend, right? Can be an option for your friend if, because of a medical condition, she is unable, of her status, I don't know what the medical condition, I'm just making assumptions now. She's unable to carry a baby to term, or if carrying a baby will put her and the baby at risk, then a surrogate motherhood is an option. And I know surrogate motherhood happens in Nigeria, right? So that can be an option for her to consider. So if she has she's producing eggs, her husband is producing sperm, so they can take the egg and sperm. So that same baby that they wanted to implant in her womb by IVF, they can give it to somebody else that is willing to carry for them to term. At the end, they do a DNA test. Be sure that this is our baby, right? It's our baby that we carry for us. And then they go back to UK with their baby. So that's an option that they can consider. It's a possibility. And that's why people have done that, right? People do that, right? They do that and there are no legal complications, so to speak. All right. I hope I've answered your question, Madam Odope. Right. If is there any other question? I'll be happy to answer it. Any other question? We can take a look at it. And of course, it could be that in the UK, going to your friends in UK, so this now, I want to assume maybe she's a citizen or she has insurance. So if it's the NHS that is paying for the treatment, they want to do something that they are sure will not fail. Even so that you don't just do a treatment that is bound to give problems because private payment for care in developed climes like UK fertility treatment can cost a small fortune. Right? Can be really expensive. Okay. Any other question or comment? It doesn't have to be a question. It could be a comment. It could be a contribution. Right? I'll be happy to take them. Okay, awesome. In the absence of none, thank you everyone that has joined us today. We'll be here again next week, Friday, 8 p.m. by the grace of God. Until then, like area they say, you can take and easy you. Sapano go kill us. Sapano go kill you. We remember I say, life you don't get duplicate. God bless you.